This is MDiTV.
When it comes to using electronic health records, the United States lags well behind other nations. But the transition away from bulging shelves of file folders may pick up speed, spurred in part by over $1 billion of federal spending to support health information technology. That money was part of the big economic stimulus package enacted in 2009. One of the benefits touted by proponents of electronic health records is access to critical information if a medical emergency strikes when you're far from home. But anything that opens up access to your vital personal information for doctors and others who want to help you may also open doors for those who might try to take advantage of you. Eduard Goodman works with hospitals to plug information leaks.
The same ability that will let a hospital, when you're on vacation, instantly see your medical history to save your life, that same convenience can also obviously be easily misused and misappropriated.
Goodman says that stealing medical information can be more lucrative than financial identity theft. Since people don't check their medical records as often as their bank statements, thieves sometimes get to keep their hands on the stolen information longer. According to market research firm Javelin Strategy and Research, the average cost of medical identity theft is $12,100 compared to $4,800 for financial identity theft. Eduard Goodman says the rush to digitize health records sometimes leads to cutting corners when it comes to security.
With every increased level of convenience when it comes to technology and information in particular, there seems to be a bit of a chipping away at those protections that surround us.
Another health information consultant says that health information protections have loopholes, and they can mean that as your personal data goes digital, more people will be able to see it.
It isn't all right for the government and the medical community to implement these systems without putting much more specific protections in place that would allow me, for instance, to say, I don't want my information shared broadly. And today, we don't get to set those rules. It's the government and the medical infrastructure that's going to be setting those rules. And that's, I think a lot of us think that's just not right.
But it's not just patients who are sharing more than they want to in a digital age. One requirement of the Federal High-Tech Act is that providers fess up when there's been a data breach affecting 500 or more patients. It's all posted on the Department of Health and Human Services website. You can find a link in the article section with this video report. Privacy breaches are not rare events. A recent survey from Identity Force, a company that works with public and private clients, found that 40% of hospitals have 10 or more data breaches annually. And the company says hospitals often don't take extra steps to protect privacy until after there's been a data breach. As for what you can do, suggestions include requesting copies of the privacy policies from your insurer and your health providers, asking for a copy of your medical records from your provider. And when you get one of those explanation of benefits forms from your insurer, check it like you would a bank statement to make sure it's for services you actually used. And monitor your credit report for accuracy. For more tips, including a link to a sample letter for requesting your medical records, check out the article with this story on the MDiTV site.